Hello and welcome to another video. I know it's been a while, but I've been a little busy lately, but I've pulled this video out and now it is time for another video. Let's get started. World War II was one of the most gruesome wars ever. New technology made killing easier than ever. Gas made soldiers cough and choke on dry land. New artillery obliterated soldiers by the dozens, and new types of guns and explosives wreaked havoc. It was truly hell on earth. But there was a glimpse of hope. Surgeons worked tirelessly to save lives every day, and medics ran and worked in the gunfire to save countless lives. But how did they do it, and what did they do? Today we'll be discussing the history of medicine in World War II. When Hitler invaded Poland, many knew that another war was coming. Great Britain and France soon declared war on Germany, determined to stop the spread of Nazi regime. The war was bloody, with an average of 27,000 people dying every day. Medics were necessary on the battlefield. They were trained with the infantrymen, but also trained in basic first aid, how to find a safe place to work with the wounded, and other skills that would help them to save more lives, and keep theirs. Medics aided soldiers on the battlefield. Since surgery couldn't exactly be performed during battle, they provided basic first aid, like applying bandages, tourniquets, administering drugs to soothe the pain, and cleaning wounds. They were the angels of war. Medics worked in the fire, with a large red cross to show that they were the medics. This was usually respected, and gunfire was drawn away, but not everyone respected it. Medics, however, were subject to mines, artillery shells, and other weapons. It was difficult to be a medic. Many had no weapons and had to choose who to save and who to leave. Medics had many different items and tools in their use. Different situations called for different tools. If a man who had been shot in the arm or shoulder, he might have a tourniquet put on. Same for a shot in the leg. Tourniquets help to stop bleeding by tightening around the artery, slowing down blood flow. Blood, of course, is very important to the human body. It transports nutrients, oxygen, and more all around the body. If a soldier was shot, they usually lost a lot of blood. This meant that without help, the soldier would bleed out. To combat this, medics usually had blood transfusion kits with them. Most of them were dried plasma. Once the medic got to the soldier, all he had to do was put some water in, and then he had usable blood. Drugs were also commonly used by medics. Pain relievers such as morphine were used a lot. Sulfa drugs, used to prevent bacterial infections, were also used. The most common were crystalline, penicillin, and sulfanilamide. Once to a wounded soldier, the medic would evaluate the condition of the wound, administer drugs, and apply a tourniquet or a splint if necessary, and bring him back to safety. Surgery was also a large part of medicine in World War II. Once the medics had brought the wounded soldier back to safety, they were then in the hands of the physicians and the surgeons. The surgeons worked in stations far behind the front lines. Litter teams were at stations 3,000 yards from the front line to take the wounded soldier to the main station. There, surgeons would evaluate what needed to be done and then try their best to fix it. Surgeons used much more advanced tools and techniques than the medics did. They could amputate limbs, close up major wounds, and do many other things. The process of removing dead tissue helped immensely in combating infections. Injuries changed also during the war. During the beginning, many soldiers had bullet and close combat wounds. But as the war progressed and the technology followed, many soldiers were now dealing with shell wounds, shrapnel flying at high speed when the shell exploded. Thanks to many advances in technology, though, the survival rate went up to 85% in a wounded soldier who was treated in the first hour. Many advancements in medicine came from World War II. Antibiotics are one of the major advancements. Antibiotics, such as penicillin, emerged during the war. They were used constantly in the hospitals and on the field. The best way to fight an infection was to prevent it. Another huge innovation was plastic surgery. When soldiers had major injuries to the face, surgeons tried to fix them as much as they could. Over the years, many techniques appeared, and with each one, a soldier's face looked closer to normal. This is a very large and important subject that deserves a totally video on its own. And lastly, another influential and widely used innovation was transportation. Before, men had to be carried away in cars or on stretchers. But during the war, air transportation became the quickest and most effective way to move soldiers, especially those who needed help fast. Planes were used that carried litters inside to house the soldiers. Today, we use planes and helicopters to rush patients off to the hospital. This drastically increased the rate of survival. World War II was known as one of the worst events in history, with over 50 million people dying. But during the war, some great innovations and great things happened as well. Medicine that would save countless lives in the future were made. That's all for today's video. I hope you enjoyed, and if you did, make sure to stick around for more.